Research has found that females are more likely to die of heart disease than men, and females are more likely to develop oral diseases than men, and there's a common connection between both. So we have discussed earlier that how oral microbiome actually plays a role in the onset and progression of cardiovascular disease. And specifically with respect to female, there is a deep-rooted common connection because oral microbiome actually impacts and metabolizes estrogen, right? So it directly impacts the estrogen levels. It can activate a certain enzyme that makes sure that the estrogen is reabsorbed in the bloodstream, thereby directly impacting the availability of estrogen. Now we know that estrogen could attach to the estrogen receptors on the endothelial cell and activate a certain enzyme called endothelial nitric oxide synthase. Now this enzyme actually produces nitric oxide, and we all know that nitric oxide is that signaling molecule that dilates your blood vessels, that actually regulates your blood pressure and prevents heart disease, right? And this becomes very important during menopause and premenopause phase, because at that time there's a decline in estrogen levels. So taking care of oral health for female becomes very important during this phase, during these premenopause and menopause phase, because oral microbiome regulates the estrogen levels, and that directly impacts the heart health. So for all females out there, you should focus on your oral health. You should, make sure that your oral microbiome is balanced and performing beneficial functions, right?